There's a real sense of isolation and loneliness that can set in. They feel as though they've done what they can do, as much as they can do, and so why does the world need me now?
As some older adults struggle with their mental health,
in many facilities, the staff are not adequately trained to not only address mental health needs, but also to identify them.
experts say it can be difficult for those who live in nursing homes to get the help they need.
And that is a huge gap in our system statewide.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I'll tell you about the unique challenges facing older adults in long-term care facilities who are struggling with their mental health, and what happens when emotional crisis meets a system mainly built for physical care.
What we realized was that there were a lot of people who had social anxiety issues if they've gotten older. They are very anxious. Some of them are just so isolated.
Ann Asman is a gerontologist who manages the University of Utah's Geriatric Psychiatry Clinic. The center works with adults 60 and older with mental health challenges, a group she says needs more help than some realize.
They're really facing the unknown. And facing the unknown is scary, causes anxiety. It can cause people to withdraw and become horribly depressed.
While Utah has focused heavily on youth mental health, data shows suicide risk increases substantially after age 65. And some research indicates that the transition into long-term care can come with several risk factors for suicide among older adults, including physical health limitations and social disconnectedness.
People that enter long-term care facilities are at greater risk of depression. Often they feel isolated.
Lori Smetanka advocates for better nursing home conditions as the executive director of the National Consumer Voice for Quality Long-Term Care. She says another challenge is that people with pre-existing mental health needs are often placed in nursing homes.
Frankly, because there's a lack of other good housing options in communities for them to go.
Because our mental health system really doesn't exist.
Nate Krippus, an attorney with Utah's Disability Law Center, also sees large gaps in our mental health systems.
But I do think that probably is leading to this problem where you're having a lot more folks with mental illness end up in nursing facilities than should be there.
A 2010 study estimated that between 65 and 90% of nursing home residents had a significant mental disorder, and the number with serious mental illness has been increasing. But experts say the system was never meant to handle mental health at this scale.
And those facilities are not equipped to, I think, provide the support services that population needs.
I've reviewed thousands of pages of inspection reports at Utah's nursing homes and found at least 18 examples of residents who attempted suicide, expressed thoughts of suicidal ideation, or engaged in self-harm since 2019. In several cases, the residents never received needed mental health services from the facilities paid to provide their care, despite clear warning signs or even outright cries for help. For example, records show a Salt Lake City nursing home resident who had repeatedly attempted suicide, expressed suicidal ideation, and self-harmed, felt she wasn't getting the care she needed. At one point telling staff she'd been hearing voices for the last 3 weeks, but no one was doing anything about this. A federal inspection report found 21 separate notes in which employees downplayed the woman's symptoms, referring to her as needy, attention, and medication seeking. An administrator told regulators she was probably more psych than we can handle, but everyone else has refused taking her. In other facilities, similar patterns, including a Mill Creek resident who attempted suicide multiple times but received only 2 mental health evaluations over the course of his 13-month stay.
I see missed opportunities all the time.
I ran some of these cases by Asman, who believes they're indicative of a lack of mental health infrastructures in facilities.
When you're going to a nursing home, whether you have a physical issue or a mental health issue, the mental health issue always is set aside for the physical issues. I don't think there's nearly enough training.
Smetanka agrees, noting that many facilities don't employ a mental health professional and that other employees may miss important warning signs.
They really need education on what are the steps that they should be taking, who should they call, and that they need to be taking it seriously.
They are calling us concerned about residents, trying to find connections to address the mental health needs.
Alliann Sipes advocates for residents in nursing homes and assisted living facilities as the program manager for the state's long-term care ombudsman office. She says she often hears concerns from facility staff who feel stretched thin and unable to address resident mental health needs.
Sometimes they're so focused on doing the daily med passes and all of the personal cares that they have to do that it's easy to get tunnel vision sometimes.
Sipes says some nursing homes have recognized the need for additional resources and are now contracting with private therapy companies.
Naturally, we're going to have facilities that lag behind a little bit as well.
The Utah Healthcare Association, which represents the state's long-term care industry, said in a statement the facilities are also expanding staff training and adapting care models to better support residents with behavioral health problems. But the association noted that nursing homes are not psychiatric hospitals and that this is a broader systems issue that requires a serious examination of our nation's mental health policies and support infrastructure to provide support for residents in the most appropriate setting. The state health department says the community can help support the mental health of older adults more broadly by expressing appreciation and maintaining regular contact with those experiencing social isolation or depression.
We were born and raised in an environment where mental health was really not discussed.
At the geriatric psychiatry clinic, Asman tries to reduce the stigma of mental health among older adults, teaching that it's as important a part of aging as physical health, and that even though life will look different,
It's a mindset. You have to understand that you may have a mobility issue. Okay, but that doesn't necessarily mean you can't do this with adaptation.
there are so many reasons
Your cane doesn't have to be a cane. It can be a ski pole.
to keep going.
It doesn't have to be ugly and,
Taylor Stevens,
I just think that we have to think beyond.
Fox 13 News,
We've got to think beyond where we are.
Utah. And if you or someone you know is struggling with mental health, there's always help available. You can call or text the 988 Lifeline, which provides immediate emotional and mental health support 24 hours a day, 7 days a week.